So my name is Ravi. I'm a professor of medicine at Washington University in St. Louis. And at the ASH 2023 meeting, on behalf of my co-investigators, I presented the poster, Updated Safety and Efficacy Results of Abbv-383, a BCMA bispecific T-cell redirecting antibody in a first-in-human phase 1 study in patients with relapsed refractory multiple myeloma. The objective of this study was to provide updated safety and efficacy results from the various cohorts and schedules that have been studied. The molecule Abbv-383 is unique in that it has two BCMA binding domains, a low affinity CD3 binding domain, and a silenced FC backbone. This leads to greater binding affinity to BCMA, lower cytokine release, and an extended half-life. The phase 1/2 study enrolled a number of cohorts. Initially, there was one patient dose escalation, and subsequently, after reaching the 40 milligram dose, a classical 3+3 dose design for dose escalation. The dose was escalated initially to 60 milligrams every 3 weeks. Then there were backfill cohorts of 20 milligrams every 3 weeks and 40 milligrams every 3 weeks mandated by the FDA for a greater number of patients experience to be garnered at that level. And finally, a 60 milligram every 4 week cohort was approved. This bispecific requires only one 48-hour hospitalization for the Q3 week schedule and only one 24-hour hospitalization for the Q4 week schedule because of enhanced immunosuppression as prophylaxis given in the Q4 week schedule, as we shall see. There is no step-up dosing. It is a fixed dose, not weight-based, and administered until disease progression. The eligibility criteria are shown on this slide, and the patient had to have measurable disease with adequate organ function. The dose escalation schema we have already mentioned, and the dose limiting toxicities were assessed by the normal NCI common terminology criteria and response rates as per MWMG criteria. The demographic of the patient population accrued is shown here in the different cohorts. To be emphasized that most of these patients, 100% were triple class exposed, and about 80%, 75 to 80% triple class refractory, and the majority were actually penta class exposed as well, penta drug exposed. The treatment duration is shown on this slide. Because of the longest follow-up, the 60 milligram cohort had a median follow-up of close to 2 years, whereas the cohort that was accrued last has a limited follow-up of 4.1 months at time of reporting. As mentioned before, there was pre-medication with H2 antagonist, acetaminophen, antihistamine, and 10 milligrams of dexamethasone for the Q3 week cohort. In the Q4 week cohort, the dexamethasone dose was increased to 36 milligrams total, thereby allowing for even shorter stay. The side effects of the drug are shown here. The grade 3-4 infection occurred in approximately 34% of patients at the 60 milligram Q3 week dose, which has the longest follow-up. The number of patients that had treatment emergent side effects were about anywhere from 58 to 70%, but there were few dose reductions required. There were some fatalities as this treatment was carried out in the midst of the COVID pandemic. The CRS rates are shown here. As can be seen at the 60 milligram Q4 week cohort, which is what is moving on to the phase 3 study for licensing, had very modest rates of grade 1 toxicity mainly. Grade 2 was only 5%, and no grade 3 or higher CRS was seen. Median time to onset of CRS is 1 day, and median time to resolution 2 days. As far as the efficacy goes, this slide shows us that the overall response rate is it's about 2/3 of patients responding. As can be seen in the Q3-week cohort at 60 milligrams, about 35% of patients had a deep response of stringent CR and CR. The Q4-week cohort, as mentioned before, has limited follow-up, and the responses are expected to deepen. 53% of MRD valuable patients were MRD negative at the 10 to -5 level. This graph shows us the progression-free survival for those getting the 60 milligram Q3-week dosing, for which we have the longest follow-up and the largest numbers. Median PFS is 11.2 months. And because of the short follow-up of the Q4-week cohort, that has not yet been reached. Key biomarker analysis done are shown on this slide. In conclusion, Abbv-383 showed a manageable safety profile at all dose levels and dose schedules studied. The low CD3 binding affinity with modified dexamethasone premedication led to very low rates of CRS and short hospital stays. The depth of response with the 40 milligram and 60 milligram cohort was respectable, with median progression-free survival at the 60 milligram cohort being about 11.2 months when given in a Q3-week schedule. The dosing regimen of 60 milligram Q4 weeks with no step-up dosing will provide wider and equitable access to efficacious therapies, and the results of these patients that are heavily pretreated merit further investigation, and the drug has moved to phase 3 testing with the 60 milligram Q4 week cohort. We wish to acknowledge all the investigators and patients. AbbVie is the research sponsor, and medical writing support for this abstract was provided by the company listed here. Thank you.